Chapter 6 covers medical terminology, anatomy, and physiology of organ systems. We will review basic anatomy in the phlebotomy course. The prerequisite was to either concurrently take medical terminology or previously taken medical terminology, so this will be a review of that chapter. This covers the media directory. Some of these slides may or may not work, so I'll make sure they are available in Blackboard. Chapter objectives. You will need to define medical terminology using word elements such as roots, prefixes, and suffixes, define words commonly used in the clinical laboratory, and describe how laboratory testing is used to assess body functions and disease. Please look at the other chapter objectives as listed in the next two slides. Medical terminology. Medical terms consist of several parts. There's the root of the word, there's the prefix, and then there's the suffix. The root of the word is basically the main meaning of the word. In this example, cardio, which means heart, the prefix would come before the root of the word, and the suffix would come last. And then there's also combining vowels, I, O, U, or Y. So word elements in medical terminology. So for example, we're going to look at the word phlebotomy. So the root is phleb, the combining vowel is O, and the suffix or the ending is tomy. Examples of common word roots: arter, which is vessel, card, which is heart, cyte, which is cell, derm, which is skin, electro, which is electricity, embol, to throw. So basic rules for combining word elements. You're going to practice pronunciation and combining vowels and plural endings. These are some table/1 gives primary word element prefixes. So for an example, we're going to go ahead and look at supra, which is above and beyond, or super, which is above. So superior vena cava, meaning above the heart. Then we got prefixes that pertain to numbers and amounts, and then prefixes that described and are used in general. An example with this would be pseudo, which means false, and we're going to talk about pseudo-positional anemia in phlebotomy, which is false positional anemia based on the patient's level of whether they're lying down, sitting up, or standing. Primary wood roots related to the cardiovascular system. These are some just common word roots that we will see. I will have you review this on your own in table 6/2. We'll focus on phleb and phlebo, both meaning vein. Thromb, which is a clot. Vein, which is vein as well. There's also suffixes that come after your roots. So for an example, penia, which is a deficiency, pathy, which is a disease, tomy, which is an incision, which if we look at phlebotomy, it's an incision into it or cut into a vein. Anatomy, physical structures, normal appearance, size, and shape, physiological functioning, process of the body, and homeostasis. We will cover these in chapter 7. So I will not review these slides. I will have you go over them on your own. The structural levels of the human body. There's tissues, group of similar cells. There's organs, 2 or more tissues. There's organ systems, and then there's organism, which is the human body. This figure breaks down the cell structures. So it goes over the cell membrane, the cytoplasm, the nucleus. Examples of human cells: we have the skeletal muscle cells, we have bone cells, we have nerve cells in the spinal cord, smooth muscle cells, blood cells, and cells lining the intestinal tract. We also have fat cells, and the nerve cells in the brain. Terms and definitions that describe the human cell. I will have you review this on your own. This can be found in table 6/5 in your textbook. Homeostasis, or a steady state, is many complex processes work independently to achieve survival, Normal functioning and energy for bodily functioning. Assessed in many ways. We would assess these by vital signs, laboratory tests, etc. Vital signs, we might take a patient's temperature prior to blood donation, pulse rate, respiration rate, and blood pressure. Sample collected from the human body. There's various kinds. I will have you review table 6/6 in your book. We can samples eliminated naturally. So an example, this would be a urine sample. Another type of sample would be a stool sample. We could also get a sputum sample. Patients would cough up the specimen into the special container. From males, we can get semen, and we can also get saliva. Other samples collected using a swab would be nose and throat swab for flu or strep throat, wounds. Vaginal secretions or pap smears would be another example of samples collected using a swab system. Samples require more invasive procedures, range from minimal invasive finger sticks to venipuncture to minor surgery. So an example of this would be blood, so via venipuncture, capillary puncture, or arterial puncture, and we cover these procedures in our phlebotomy course. Tissue biopsies, needle aspirations, cerebrospinal fluid, bone marrow, and other bodily tissues. We're going to go over these as well when we start looking at the non-blood specimens that are obtained in phlebotomy. Collected with the swab, nasal throat for flu and strep, wounds, vaginal pap, eliminated naturally. Just as a review, urine, stool, feces, sputum, semen, saliva, hair, and skin. Invasive procedures required for collection range from finger sticks to a venipuncture to minor surgery such as biopsies. All require special procedures, cleansing and sterilization, and proper training. Examples include venous or arterial blood, capillary blood, tissue biopsies, cerebrospinal fluid, bone marrow. They can be getting from the areas of the synovial, pleural, and pericardial areas. There's different types of body cavities. There's the thoracic cavity, the pericardial cavity, the abdominal cavity, the pelvic cavity, the abdominal pelvic cavity, the spinal cavity, the cranial cavity, and then you look at them as a whole in the ventral cavities and the dorsal cavities. Anatomical terms, so anterior, in the front of, posterior, behind the back, and medial, toward the midline. And this gives a image of those terms. Also, too, when we start looking at distal, which is away from the body, proximal, which is closest to the body, and when we look at the dorsal, which is our feet, there's also the superior, which is the top half of our body, and then the inferior, which is the lower half. So anything from the waist down. Superior would be from the waist up. Terms related to body orientation. So there's distal. Distal is away from the point of attachment. Proximal is near the point of attachment. Superficial is near the surface of the body. And deep or far from the surface of the body. Lateral is toward the sides of the body. Dorsal is our back side, ventral is our front side. Body positioning, normal anatomical position, erect standing positions, arm at rest, palms forward. Supine position, lying face up on the back, good position for performing phlebotomy from patients who are in bed. Prone position is lying on the stomach, and lateral recumbent position is lying on the left or right side. And this is just images of what those terms look like. Clinical alert. When speaking with patients, phlebotomists should refer to the patient's right and the patient's left sides. Practice using the terms when facing face-to-face with a patient, because we got to remember that when we're facing them, what is technically our right side is opposite when we're facing a patient. Again, this is just review of the body cavities. The anterior and posterior body regions, I will have you review these on your own. We will be looking at the antecubital area of patient's arm. We will also be looking at the back of the hand when we perform phlebotomy procedures. Terminology, examples, body regions, and their location. I will have you review table 6/8 on your own. As well as figure 6/10. We will have a detailed chapter 7 covers our cardiovascular and lymphatic systems. We will review those in class in detail. I will have this animation available to you in a separate piece on Blackboard. This is just the animation of the body systems and the skeletal systems. Major organ systems, there's disorders, pathological condition of the mind or body, disease, specific measurable condition, clinical symptoms, laboratory radiology results. So an example of this, a specific disease by radiology would be a condition of a broken bone. Illness, subjective departure from wellness. So it's something that the patient has to tell us in order to see it. So pain, suffering, and distress. Table 6/9 again covers the organ system functions and what their main component is, so I will have you review these on your own. Role of the clinical laboratory in assessing body functions. We have screening, diagnosis, treatment, and monitoring health. It consists of skin, hair, sweat, oil, glands, teeth, and fingernails, and serves for protection regulatory functions as insulation, thermal regulation, excretion, and production of vitamin D, and this would be our skin. The cross-section of the skin, which looks at the epidermis and the hair follicles. The fingernail. We would utilize this image when we're looking at performing capillary punctures on the back side of the finger. Skin is the largest organ of the body, protects deep tissues, provides barrier to microorganisms and foreign bodies, protects tissue from hazardous exposure, and prevents water loss and allows for precipitation, and stores fat next to tissues. This allows sensations like touch, heat and cold, pain and pressure to be felt. The sebaceous glands produce oils for hair and skin protection, and sweat glands produce perspiration to cool the body. Bacterial infections, so acne would be an example. Viral infections, fever, blisters, or cold sores, rubella, rubelio, chickenpox, and herpes. Also, shingles are an example of viral infections that happen to our skin. Fungal infections, so ringworm or athlete's foot, allergic reactions, dermatitis, eczema, and psoriasis, skin cancers, malignant melanoma, and insect bites and burns are other things that can happen to the skin. This is an example of hives. Sometimes it presents as welts. This is our body's natural reaction to an allergy, whether it be to food, medicine, or something we touch. This is dermatitis, which is caused by poison ivy. As you can see, it's almost like blisters that are weeping start forming. This is the inflammation of the skin. This is acne on the face. This is herpes simplex. This is second-degree burns. As we can see, they're starting to fill. This is malignant melanoma. Skin scrapings are biopsy specimens or laboratory tests that can be performed. Viral or fungal cultures, we can do a KOH preparation or biopsy staining procedure. The skeletal system, bones, cartilage, joints, ligaments, and tendons. Terminology related to movements, so we can have rotation, extension, hyperextension, flexion, pronation, and supination, extension, as well as abduction and adduction. And this is figure 6/15 of the skeletal system. And this is another video to show the motion in a typical gliding joint. The skeletal system serves the body in 5 major ways: support, protection for softer tissues, brain and lungs, movement and leverage, hematopoiesis, which is blood cell formation in the bone marrow, and mineral storage. This will conclude Chapter 6, Part 1. Please go to the next slideshow for Chapter 6, Part 2.